Dr. William Gertz is a thromboembolism specialist from Sunnybrook Hospital in Toronto. He's been teaching patients about clot prevention and how to take their at-home Fragmin self-injections for over 10 years. Let's hear from Dr. Gertz.
The circulation of blood around the body is essential for life. The heart pumps blood to all parts of the body through the arteries, while the veins bring blood from the body back to the heart. Normally, blood flows smoothly through the arteries and veins without interruption. Occasionally, the blood clots where it shouldn't, for example, inside a vein. Such abnormal blood clotting is called thrombosis. A small blood clot may increase in size inside a vein, where it can then block the flow of blood through that vein. If a blood clot or thrombosis develops in a major vein of the body, it's called a deep vein thrombosis, or DVT. DVTs can develop in veins anywhere in the body, but they most commonly develop in the veins of the leg and thigh. Blood clots in the leg veins start off very small in size and then may grow. The initial small leg clot may not cause any symptoms, but a larger blood clot, or DVT, in one or more leg veins may cause pain or swelling in the leg and may make it difficult for you to walk. The leg with a clot may also be warmer than usual, may be reddish or purplish in color, and is often tender to touch. A blood clot in the deep vein of the leg sometimes breaks off and travels to the lungs, where it can produce shortness of breath, chest pain, and or coughing up blood. A blood clot that ends up in the lungs is called a pulmonary embolism, or PE. This can be a very dangerous situation. Blood clots can develop for many reasons. Blood clots can form after a major operation, such as hip or knee replacement, after injury to the body, or after a major illness associated with bed rest. Blood clots may develop in patients with cancer. This is referred to as cancer-associated thrombosis, or CAT. The risk of blood clots may be increased when cancer treatments are being given, including surgical removal of a tumor, chemotherapy, or hormonal therapy. Clots can also develop during and after pregnancy, or in association with taking the birth control pill or hormonal replacement therapy. Patients who have intravenous catheters inserted into a vein of the arm, neck, or upper chest sometimes develop clots around the outside of these intravenous catheters. Sometimes blood clots occur more commonly in certain families, and there may be subtle abnormalities of the blood which make it more prone to clot when it shouldn't. Finally, some patients who have a DVT or pulmonary embolism have no obvious reason for the clot.
Doctors can prescribe Fragmin to reduce the risk of a blood clot developing or to treat an existing blood clot. Dr. Gertz will now explain how blood clots are treated if your doctor has prescribed Fragmin to treat an existing clot.
Blood clots require treatment for several important reasons: to prevent the clot from getting bigger, to reduce the risk of blood clots going to the lungs, and to prevent any new clots from forming. Blood clots are treated with an anticoagulant. Anticoagulants reduce the ability of the blood to clot. You've been prescribed an anticoagulant called Fragmin, which is given as a tiny injection under the skin. Fragmin helps stop the abnormal clotting of blood and thereby helps to prevent the clot from enlarging. Anticoagulants do not dissolve blood clots. The body does this slowly over a period of weeks or months. In the past, patients with DVT or pulmonary embolism had to remain in hospital for several days or weeks to be treated with an intravenous anticoagulant called heparin. Nowadays, most patients with DVT and some patients with pulmonary embolism are treated at home with an anticoagulant like Fragmin. Fragmin comes in two forms. First, pre-filled syringes. These syringes already have the correct dose of Fragmin and are ready for injection. Second, multi-dose vials. These glass vials contain more than one dose of Fragmin. When using the vials, you'll have to fill a syringe with the correct dose of Fragmin from the vial each time. Most patients who take Fragmin use the pre-filled syringes because they're so simple to use and are more convenient. However, your doctor may have chosen Fragmin in multi-dose vials for you because of special circumstances where this form is more appropriate.